So let's talk about something that most consumers don't even know to ask. Is your medication a pure pharmaceutical grade medication, or is it compounded? There is a difference. In the case of a pharmaceutical grade medication, they are manufactured in FDA regulated facilities. They must undergo strict manufacturing standards, and they are very regularly inspected for things like dosage accuracy, purity, and quality. The FDA also requires these drugs to be FDA cleared, meaning they have to undergo clinical trials to prove their safety and effectiveness. Compounding pharmacies serve a specific purpose to customize drugs for patients who have specific needs. For instance, if a patient is allergic to a filling agent or a dye, maybe they need a liquid form rather than a pill form, or perhaps the dosage they require is not pharmaceutically manufactured. Another case where these drugs can be compounded is when the FDA places a drug on the shortage list. There are two types of compounding pharmacies. 503A pharmacies are the little mom and pop shops in your neighborhood where a community physician is writing a prescription for a specific patient. These pharmacies are not regulated by the FDA. They are regulated by the State Board of Pharmacy. The other type of compounding pharmacy is known as the 503B compounding pharmacy, and these create much larger batches that are distributed on a much larger scale. These pharmacies are also regulated by the State Board of Pharmacy, but also have to register with the FDA. The FDA does not hold the same standards to 503B pharmacies as they do for pharmaceutical companies. The standards are much lower and they are inspected far less frequently. The standards for purity, quality, and dosing is weaker. These drugs, compounded drugs, are not FDA approved, so they do not have to prove efficacy and safety. They do not have to prove the same level of purity. They do not have the same labeling for safety and consumer information. The safest and highest level of medical care is always to prescribe a pharmaceutically pure, FDA-approved medication. Compounded versions should really be reserved for cases when a drug is truly on the shortage list or when a patient's needs cannot otherwise be met. A good example would be the GLP-1 drugs. Compounded versions of these are associated with an increased likelihood of medical complications because of impurities, other ingredients, misdosing, and other quality issues. Another great example would be hormone pellets, which are not FDA approved because they are compounded drugs. This is a whole nother conversation, but the short answer, they are not recommended. So always know what you're being prescribed because your safety matters.